Welcome to Arista MD's virtual conference, or welcome back. This is our second session, providing access to pediatric specialty expertise by extending eConsult offerings to internal and external requesting providers. Heather Meyers, Director of Virtual Care, and Patricia Hanrahan, Senior Product Manager of Virtual Care at Boston Children's Hospital, will be presenting for us today. I'm going to leave the stage and I'll return towards the end of your presentation to ask any questions.
Great. Hello, my name is Heather Meyers. I'm as Kate mentioned, I'm the Director of Virtual Care at Boston Children's and have been in the telehealth space for over 12 years. So very near and dear to my heart to be able to have a presentation to share with you all here. And I'm also joined by my colleague, Trish, which I'll let her introduce herself as well.
Hey there, my name is Patricia. I work at Boston Children's as the Senior Product Manager overseeing our provider virtual care programs. I've worked for quite a few years just in different sectors of the healthcare space and looking forward to share more about our eConsults program today.
Great. And today we're going to talk through our journey of launching and expanding our eConsult programs, all through the help and expertise of the Arista team and the platform that they have. Let me go to the next slide here. We'll start by covering a little bit of background of who Boston Children's is for those who are not familiar, as well as the team that we sit in, the Innovation Digital Health Accelerator. And we'll go into what virtual care at Boston Children's means, and then we'll spend the majority of our time covering our eConsult offerings. And we think about this in two ways, both from our primary care providers as well as with our partner hospitals through some of our subspecialty care delivery there. So about Boston Children's has been and continues to be a world leader in compassionate, equitable care and services. And really our vision and goals are to lead change in the care and well-being of children. We're really focused on child health and what that means. And we truly believe that they are the future generation, and really wanting to ensure that there is success by us offering cutting edge research, state-of-the-art innovation and clinical care, as well as the development of new drugs and therapeutics and devices. And that's a lot what our team does to really help look at solving the problems of tomorrow for the kids that we're able to serve. And a lot of our virtual care efforts all focus around these pillar vision areas, and also from children that come to us from all over the world. It really gives us an opportunity to leverage our expertise in the programs that we offer through virtual care to be able to treat them and extend that expertise and maybe a way that they would never actually be able to tap into Boston Children's. And as we think about our mission, and again, a lot of what we do in the telehealth virtual care space is also focused around this. As we think about caring for children who are unique, and that we have a unique ability to serve, which our focus is on rare and complex. Also second on researching and developing new treatments to improve the child health as we run one of the largest pediatric research programs in the world, as well as teaching and educating the next generation of pediatric leaders. And we have our appointment that we do in collaboration as Harvard Medical School's primary pediatric teaching hospital. And then the last is serving the community as a care provider, also as a safety net. A lot of what we're doing is in collaboration with payers, as well as with our Medicaid, and really helping to be a safety net partner there as well. So a little bit about our Innovation Digital Health team, which is the group Trish and I are a part of. Our team really comprises of three focus areas. First is on digital health, and this is really our group that focuses on our digital strategy and our transformational ops, which really becomes the foundation of care delivery for the future. This is the group that Trish and I sit within and really help to be very specialty focused and how we can leverage and expand that expertise from our internal clinical groups. Second, also on our innovation and accelerator, which is really focused on partnerships with external startups as well as internal innovators on bringing some of that promising tech to improve that childhood health. And then on research, really in line with the mission of Boston Children's, we have one of the more robust R&D teams and really trying to leverage and build out more of the innovative, globally recognized tools. So really our role at Boston Children's is shaping the future of healthcare and being able to extend our expertise globally. And we'll get into what that looks like as a whole, and really excited to share from an eConsults perspective as well. We kind of think about our team in three focus areas: innovation, which I focus on our digitally enabled teams, a lot of where our AI work lives, and then also for connected care. And our connected care team is really focused on creating, enhancing, and tailoring our patient provider access and engagement channels, as well as those care delivery offerings. And we firmly believe this is the foundation to the hospital of the future, and are committed to both integrating while also optimizing all of those efforts to ensure that it is the core fabric of our hospital. We think about connected care under two umbrellas. The first is ones that we are able to enable to our patients from our providers, which is all the left side of the screen in pink, and also ones that we are able to enable to our other local, and I should say global providers as well, from our specialists, which is the blue side of the screen. And these can either be done through, I think, as most people are probably aware of what telehealth is and what that encompasses. We can either do this through our live video programs, which is the top, or we could also do that through asynchronous online programs, which is the bottom. That's also where eConsults offerings live as well. So as we were thinking about launching off our eConsult program, we actually had a historic eConsult program at Boston Children's that kind of lived for many years and was actually had great successes. There was great publications, but it really wasn't an enterprise effort. And it was really important for us to, if we're going to get behind this and kind of put our IDHA team, our digital health resources into that, to really think about how do we partner, and is this of value, and is the time right? So it's really important for us to understand what the value proposition is, not just for Boston Children's, but also for all stakeholders involved. And we really thought about this across 5 stakeholder groups. The first is from our BCH enterprise, and does this actually give us the opportunity to increase our complexity care, which again, we're more of a complex and rare destination hospital, as well as reduce some of the appointment lag times. I know it's a big struggle that everyone has capacity constraints, and just kind of thinking through how do we really optimize our provider time. From our specialist, our specialist often gave us kind of insights that there's a lot of curbside consults that are coming to them, whether through email, phone call, and is there the opportunity to streamline these and also ensure that there's kind of a net new revenue based and kind of reduces some of the liability concerns that they might have by sharing and extending too much for patient care, as well as for our primary care providers. And Trish will go into kind of what our primary care makeup is at Boston Children's, but also being able to have kind of enhanced education, more expedited access to specialists for patient families on avoiding travel that they could actually just receive right in their community PCP office. And then also from the payer perspective on are we actually able to reduce overall cost of care delivery by reducing visits or more adverse events from that perspective. So this was really kind of the focal point for our why. And then in parallel to this, we also got engaged by one of the largest Massachusetts commercial payers on doing a collaboration that would actually look at quality outcomes and cost outcomes. So a lot of those partnerships also kind of drove us to wanting to scale and be more enterprise-wide focused from that. So I will hand over to Trish, who is going to cover really how we think about eConsult in terms of the modeling and some of the successes we've seen.
Great, thanks, Heather. So as Heather mentioned, as we were looking at really how we can operationalize the different eConsult models across Boston Children's, we saw 3 main models as our opportunity areas, which includes a primary care model, leveraging both internal and external eConsults, as well as a inpatient eDerm model that leverages working with some of the partner hospitals. So when initially launching, we wanted to initially launch our internal eConsult model. And when looking at different opportunities, why we really chose to work with Arista is the opportunity to leverage our own specialty pools, as well as developing some of our own workup checklists based on condition or symptom, and ultimately having that patient-facing final report to summarize the eConsult, as well as knowing that longer term, to be able to go externally, Arista could help bridge the interoperability gap. So when initially launching the internal eConsult program, we launched using just the browser-based solution with single sign-on. Here at Boston Children's, we have a complex EMR structure, so we couldn't directly integrate. But based on some of the initial feedback we received, we worked to automate portions of the workflow to make it more operationally sustainable. From there, we expanded externally in our primary care model to our affiliated care network. They are on a single separate instance of Epic. So working with them, they integrated their workflow in order to really increase some of the adoption across primary care providers, as that mimicked some of their other operational workflows, such as submitting referrals or following processes that clinicians were already used to using. And then ultimately, we saw dermatology being one of the highest utilized cases for the eConsult model, and really saw the opportunity to also partner with Arista here, leveraging more of their photo solution to work with requesting providers on some of the inpatient pediatric units to send dermatology consults to our Boston Children's consulting dermatologists. They leverage that photo solution to submit photos and are able to communicate through the Arista platform. So our program has gone through sort of an evolution, starting with the internal pilot to where we are today. So taking you through that, when we initially launched internally, that was with our own Boston Children's primary care sites. We have 3 sites that can act as a primary care site. So starting to launch with those, and then 6 consulting participating specialties. Based on that, we gathered a lot of initial feedback from our pilot and made some incremental improvements over that year, and then ultimately launched externally with a small group of pilot practices to then also collect some of the initial feedback on the workflow for external eConsult submission. During this time, Mass Health also released, for the Mass Health ACO, they released certain criteria for the primary care tiers, and for primary care to reach higher tiers and then in turn higher per member per month payment, that PCPs had to have access to eConsults as some of the criteria for the higher tiers. So hearing that, we knew that we would be rapidly expanding our eConsult program and needed to put some of those foundational improvements in place just to help some of the operational feasibility from both the requesting and consulting provider side. So from there, we started working with the Arista teams as well as our Boston Children's IT teams to put in a series of some of the IT automation across the patient registration for any patients that weren't established at Boston Children's, and then also the encounter and allowing the documentation to flow more in an automated workflow versus previously with the pilot program, it was more in a manual operational processing. So this helped set up the infrastructure for us to be able to expand externally as well as internally. Internally, we heard the need and interest from both urology and adolescent med to expand as consulting providers. So expanded those spring of this year as additional consulting specialties. And then in parallel, also started the expansion for our external affiliated primary care network. So the external network is using the integrated Arista requesting provider workflow in order to submit those in a more streamlined fashion. And they're also submitting any of the documents as well to ensure there's a comprehensive eConsult submitted for the specialists to review. We expanded across the external practices to about 100 offices and around 600 providers. We granted them all access in line with the Mass Health Medicaid ACO deadline of July 1st, and then conducted a waived training approach to ensure there were enough opportunities for the requesting providers to attend a live training, as well as ensuring an incremental volume increase as well. And then in parallel over the summer, we began to launch our inpatient EDIR model, which leads us to where we are today, which as Boston Children's EHR landscape changes and moving more towards Epic, we are working to integrate Arista as both the requesting and consulting provider workflows to streamline that and ensure that any of the eConsult requests are coming through are a consistent workflow for our providers to consult on. We're also expanding the EDIR model and then just overall exploring any other models that could serve our Boston Children's enterprise as part of the developing eConsult models. To dive more into the primary care model and what that looks like, this follows a pretty standard eConsult workflow, but can call out some of the nuances that we've put in place. So for our primary care eConsult workflow, it starts with a primary care provider submitting a question, and those should be some low acuity questions that are not urgent in nature, and they are able to select the specialty as well as condition and submit their question with some of the suggestions from a specialist of what to include based on that condition and the developed workup checklist. So the PCP submits that. It usually takes them about 15 minutes or less, and then that goes to the Boston Children's specialist that reviews the question and provides their treatment recommendation back. Since these are low acuity cases, the SLA we have in place for our program is a 3 business day SLA, and it's typically taking specialists 5 to 10 minutes to review these and respond. Once they respond, the PCP reviews those recommendations and then can triage care with their patient appropriately. Based on our current participating specialties, we still have 8 live consulting specialties today. And then across the requesting provider sites, we have just over 100 requesting sites, leveraging all Arista, but in different ways, as you saw, how we're using the technology. And then our virtual care team at Boston Children's really leads the implementation, but in partnership with Arista to provide the technology as well as some of the technology support as needed. When we initially launched our new eConsult offering, we definitely saw and heard the need from providers to more clearly differentiate in what scenarios they should be using an eConsult versus a referral. So the clinicians from both internally and externally, as well as both on the requesting and consulting side, developed a care plan path to give better guidance on when an eConsult versus a referral should be utilized. So at a high level, we view eConsults as more of a brief, low acuity question focused to one specific condition that is not time sensitive and would be a new patient to that specialty, versus a referral is still meant to be used for those scenarios that require a live physical examination or a more urgent request, or if the patient's already established with that specialty. So this is continued to is continued to be utilized as sort of an educational tool and reference material as part of our trainings to guide the primary care model appropriately. Looking at the outcomes from our primary care model, we've definitely seen a steady increase since our initial go live and consistent utilization, most recently seeing that expansion in the most recent months externally to see broader utilization across that front. Across our specialties, we see dermatology as about 50% of all of our eConsults, and always raises a great use case for store and forward technology and eConsults. Our other highest utilized specialties are also endocrinology and gastroenterology. And then from our early outcomes, we've seen great success. About 60% of those eConsults can be treated primary care and locally, and about 40% ultimately recommended for that specialty visit. Overall, great experience and feedback from both the specialists and PCPs. And of all eConsults, about 90% of those are influencing the patient's care plan, showing that the suggestions are meaningful when they're being taken back to the patients. Other feedback we've heard from our specialties in particular that are less quantifiable, but definitely show still the value that eConsults have on the specialty, are even if the patient is ultimately referred to be seen by that specialty of that 40%, a lot of times when the specialist responds, they can help guide the patient to the appropriate clinic for their condition, or they can also provide the initial labs that the patient should complete and bring to their first appointment, or also providing interim guidance to start on treatment and be able to see how that treatment is reacting once they are ultimately coming to the specialty, which overall just leads to a more efficient first appointment with that specialist too. Switching gears a bit, going into our newest model, which is the inpatient eDerm model. We've seen a need across New England for more of the pediatric support, and dermatology really has a great use case for being able to provide that virtually. So eDermatology provides remote consultations to pediatric inpatient units at a hospital that are able to consult our Boston Children's dermatologists. So the main goals of this is by using eDerm, they are able to have more access to that pediatric support virtually, overall improving the experience of both the clinicians and patient families, and also able to keep some of that care locally. Knowing that photos are such a critical part of the eDerm model, the requesting site is using a dedicated iPad to take photos and submit those via the Arista solution, and then submitting the eConsult form as part of the Arista software, either on a desktop or laptop, whatever preferable. And there are also customized specialty check-up lists, knowing that the inpatient model is a little bit different types of conditions than we are seeing in our primary care model. So overall, this workflow is fairly similar for also the standard eConsult workflow, but calling out some of the nuances since this is inpatient and also focused around the photos. So the requesting provider initially takes that image, and there is a set guided list of photos that should be provided as standard as part of the eConsult. So the dermatologist is able to effectively review the eConsult. They submit those to the BCH dermatologist, who receives an email notification. They review all those images as well as the patient history, and are able to respond with a treatment plan, where the requesting provider then also reviews that response, and it can generate the final report that includes the details of the conversation as well as the original images. Since this is an inpatient model, the SLA is a little bit quicker, knowing that these are generally more urgent requests. So our SLA is 2 business days. But with that being said, our dermatologists typically have a response within hours, knowing the criticality and wanting to get some answers back to the requesting site. So overall, just as we look at how we have deepened our collaboration with Arista MD or our partner specialties and organizations, this is sort of how we look at our implementations, whether that's expanding a model with a primary care model with a new specialty, or expanding externally with a new organization. It's really a collaborative approach between our virtual care team, that organization or specialty, as well as Arista MD providing the technology. So on our Boston Children's side, we're leading and coordinating a lot of the workflow development, whether that be technical, clinical, administrative, as well as starting to put together any reference guides and materials based on the user role. We also partner with the with all parties in order to develop the training materials and provide that training to each of the user roles, and whether internally or externally. The expanding specialty or organization is really meant to inform on some of the nuances or sharing their expertise for their particular area or site. And then Arista throughout this process is providing the technical workflow development and input. They are setting up the sites and configuring that based on the model that we are implementing, and then helping test the eConsults. We also collaborate with them for training materials, as well as the live trainings. And of course, they're providing the ongoing technology support too. So I hope this gives a overview just of sort of how we've thought about how we can deepen our collaboration across all parties, and insight of how Boston Children's in particular is seeing the value of eConsults, whether that's internally or externally with primary care or in an inpatient setting.